So one of their strategies in Africa specifically is Young Africa Works, and the other one that we are plugging into with this proposal is youth employment in Africa. And as you know, it's a major issue, even not just about the young people seeking work, but even graduates who can't find work. And I hope you can see this video.
We had sound earlier, Steve, but I'm not receiving sound now.
Can you not hear the sound?
No, and the screen's also disappeared now.
Okay, let me try that again. Sorry. It's a very short clip. I forgot to click the includes computer sound. That was it. There we go. I'm going to just start that again.
Africa's young people are its greatest resource, and it's because this is where the innovation lies, this is where the energy lies, and the only way the continent can actually move forward is by tapping into that resource.
We're at a point in time when there are 1.8 billion young people in the world, the largest population in the world. There's never been a youth population this large. So shaping the future for this young generation is going to be essential.
Employment is a big issue, and it has been a big issue in Africa because the resources are few, population is huge.
As a young person around the continent, you don't have lots of choices, do you? You have something you're passionate about, but you may not have those opportunities really coming to you.
There are millions of young people who are graduates, but they're not employed because the current job opportunities cannot uptake all of them. And that's why we need to be very innovative. We need to be very open-minded, create more opportunities for young people.
Young people are innovative. Young people are curious. Young people want to be able to possess skills that will help them solve problems in agriculture and technology, education and science.
When I think of even myself as a young farmer, I don't want to spend all my days in the farm. I want to be miles away and monitor what's happening on my farm from my mobile phone. I don't want to have to carry my goods to the local markets to get a buyer. I want to go to a digital platform and look for buyers.
We are energetic. We are innovative. We can always come up with something new. We are restless. We don't settle for less. So we should get up, get the zeal and determination to see our countries move forward.
Okay, so that's where MasterCard is coming from. And I think it's important, that sort of background, because we're going to enter quite a long-term relationship with this funder and with all the other partners. So as this slide shows, the focus of the proposal is on primary healthcare, and which is why we have taken the sort of front seat as face. And what it shows is that primary healthcare service delivery has the opportunity to, for formal job creation, much higher than any other area of health, of the health system. So part of the motivation is getting people, young people, into jobs in the health system, and you'll see how that's how that is structured in the proposal. So really the focus that we've come together around is on youth unemployment, and specifically graduate unemployment. So there are a number of, in South Africa, a number of graduates, even from UCT, who can't find jobs. And that's a specific issue. But as we go through this, I think you'll see more specifically what we're aiming at. You've probably seen this before from the faculty, the deanery team's massive transformative purpose, igniting agency for an inclusive and just society built on health equity, which resonates with the MasterCard sort of idea, focusing on youth employment. And they've been working on a draft strategy for the next 3 years in the deanery. This is a document which is in the mix at the moment. So, as you know, we are looking at the FACE department and our massive transformative purpose of building inclusive communities of care together. We'll have the strategic planning for our department next week, but this MasterCard proposal could potentially accelerate a number of the processes towards our MTP. So we'll go into that next week, but just to zoom back out again, at the top are the values of MasterCard Foundation. Bottom left are the Western Cape Government Health and Wellness values that they put on their website. And bottom right are the UCT values. And just looking through them, we think there's sufficient synergy to partner with both. Obviously, we are already partnering very strongly with Western Cape Government Health and Wellness. But I think the MasterCard Foundation is worth considering as a collaborative partner. We've decided the project should be in 3 sites, 3 sub-districts. As you know, Klipfontein, George, and Saldanha. And
Then my sister sent me a message and I'm answering the WhatsApp, but now we're pushing the robot and the car slowing down. So I just grabbed my phone and off we went.
The same thing happened.
See his face.
I don't know how to mute her.
Steve, let me see if I can do it. Hold on. Otherwise, Lungisa may have.
I've just muted her.
Okay, thanks. Okay.
Thank you.
Thanks. When you're presenting, it's difficult to do that sort of thing. So the 3 sites, as you probably know, and they're these are the population numbers and the unemployment rates. Actually higher in Klipfontein than others, but sort of equivalent numbers, high Gini coefficients, and equivalent number of PHC facilities. So why these sites? Because they build on existing UCT investments that we've made in these sites already. It catalyzes our transformation strategy. And we want to focus on rural areas because we want to develop health workers who will stay in or return to rural areas. So one of the pushes is going to be selecting and recruiting and selecting potential students from rural areas. And there's this issue of social accountability, the idea of reference communities. To whom are we accountable? Lionel Green-Thompson's thing is, as a result of our engagement with either the George or Garden Route district or the Saldanha sub-district, have we made a difference? What has been the impact after X number of years? This funding is unusual in that they've told us up front it's for 8 years. Now, I haven't had funding like this for an 8-year period ever. The maximum I've had is 5 years, which seemed like a long time. But it means that we have the opportunity to innovate and try things out, monitor whether they work or not, and then decide whether they're worth continuing or changing or stopping. So that's a major part of this is innovation. We think these sites are representative of many communities in South Africa and Africa with low socioeconomic development, high youth unemployment, and an relatively underdeveloped healthcare sector. Klipfontein rural, Saldanha rural, and George sort of rural and peri-urban. And we're focusing on these areas because we want the denominators. We need to circumscribe the areas in which we work in order to be able to measure changes over time. And we think they could act as exemplars and learning and provide models for elsewhere over time. This is probably the most important slide of the whole lot because it sets out the 4 key objectives. You can remember it as the 3 E's and the network. Employment, entrepreneurship, and ecosystem. And I'm going to go through these subsequently in much more detail. But upfront with employment is to enable students to acquire advanced skills across a broad range of disciplines critical for sustainable health sector growth and transformation. It's basically enabling young people to get into jobs or onto the ladder, the career ladder within the primary healthcare sector. And you'll see what that looks like in a minute in more detail. And then the second objective is around entrepreneurship and innovation, the capacity for innovative interventions and practical improvements to improve the quality of life and well-being. Using social innovation and entrepreneurial systems to reduce unemployment. And specifically, we want this objective to focus on community-oriented primary care and emergency care. That'll be very familiar to some of you, but adding this entrepreneurship component. And we are largely not outsourcing, insourcing this objective to the Graduate School of Business, specifically the Bertha Center and the Solution Space. So they have a lot of experience in social innovation. It's really their theme, and we want them to focus it specifically within the health sector. Then the third one is training capacity for what they're calling the health ecosystem, but it's basically enhancing our capacity to train skilled workers for universal health coverage. And so here we're looking at what we're already doing and a whole lot of new courses, mostly postgraduate, to upgrade our ability to actually train. You'll see what that looks like in a minute. And then finally, the learning network is working at developing a long-term network of partners, both those across the rest of Africa as well as the local partners in the 3 sites, to learn together what works, what doesn't work. This is the opportunity to try things out that we would otherwise not be able to try out. As you know, the higher education space and the health sector, in fact, all government departments are under huge financial strain. Managers have been told to cut their budgets. We're being told in the university to tighten our belts. And the easy thing would be to try and fill those gaps with soft funding like this. But we know it's not going to last forever, and we need to look for sustainable solutions, solutions that can generate income and not just plug gaps. So that's going to be a constant tension. But I think if you take away anything from this presentation, it's about those 4 objectives, and let me explain them in a bit more detail. We've reached out to other departments within the faculty, or the 40 towers, the Faculty of Humanities, specifically social work, the GSB, as I said, the Schools Development Unit, SHAWCO, UCT Online High School and the Knowledge Translation Unit within UCT. And then obviously Western Cape Government and community partners in the 3 sites in Thembalethu, in Friedenberg, and at Philippi. And we'll need to develop those relationships further. But the first objective, the health employment objective, the first part of it is to support development of peri-urban and rural youth into health employment by growing our own timber. So we're talking about the school's development unit upgrading maths and science from grades 10 to 12 in 30 schools. They've got a well-developed system for this, and what they need is a bit of petrol in their tanks to be able to implement it in the 3 sub-districts. It goes with career guidance and the provision of basic digital skills, and those hubs that I mentioned on the last slide have computer labs, etc., in the townships, and that are able to cope with large numbers of kids. And then health and psychosocial support through AfrHE-HCo and Planet Youth, which I won't go into now, but maybe we could come back to that. The second part of the health employment is the support and development of career pathways, upskilling of community health workers and mid-level health workers, again growing our own timber to improve their maths and science to get a better matric, community health workers with special skills and interests, you know, the sort of mid-level health workers. Community health workers don't earn a hang of a lot, but if they can get onto the career ladder, they can start their way up, improving their prospects. EFAR is emergency first aid responders. We initially had that in the proposal on a grand scale, and MasterCard asked us to scale it back, I'm afraid, Clint. It was initially there, and they said it was, I can't remember their reason, but they basically said chop it. We've retained the training part of that proposal though. And then mid-level health worker specialization, we're talking about you know, phlebotomists and people who actually make the system work at the middle level, both salaries while studying and covering their bursaries. So that's the third part of health employment is actually for general clinicians with additional skills in service delivery. So we're talking about the BSc in biokinetics. You'll be pleased to hear, if you're on this call, Jacqueline, the postgraduate diplomas with which some of you are very familiar, and some new ones, a PG dip in forensic nursing, palliative nursing, and youth and adolescent health. So that's part of the innovations that we want to promote. So some of these are just handing out diplomas so that more students can register from those specific areas, and some of them are the development of new opportunities. Similarly, there's the already mentioned BSc in biokinetics and specialist clinicians. That's right. We want to add 2 registrars per site, and that would be in consultation with the managers in those sites as to which kind of registrars they want. And then there's masters bursaries for nursing or health and rehab. In fact, I think it's 2 per site, or 2 or 3 per site. I can't remember the number. It has changed over the last couple of weeks. So that's really the support for service, as opposed to objective 2, which is health entrepreneurship. And this is what I say, we have asked the GSB to help us with, the support and development of social innovation and entrepreneurial ecosystems to reduce unemployment. I know less about this than some of our partners in the GSB, but they have a whole thing going around entrepreneurship, and they're quite happy to focus it on primary healthcare. They have something called the initiative, what is it? Social, SIHI, Social Initiative for Health Innovation, something like that. And some of you might remember that they had an intervention at AfrHE-HCo Hospital, the Bertha Center, where they were trying out all sorts of new ideas. They have a fellowship. Here's the SIHI at the bottom. The fellowship for early career researchers who are trying to promote social innovation in health, and they're very keen to support those students in each site. So that's quite an interesting space. It's the funding gives us the opportunity to fail if necessary, to try things out that may or may not work, to monitor whether they've made any difference, and to adapt and see what is actually sustainable. So this is the one around community-oriented primary care. We really want to establish innovation hubs with a family physician, a nurse, a health and rehab worker, and an early career social worker in each site. So we'll have a little clinical team in each of the 3 sites eventually. There's a community surveillance program run by Andrew Bull called C-Sharp that we want to support, as well as WOW, and obviously the PAC community clinical support tools, which are already in place. And then there is a partner called Nyamagela for Care. This is under the Perinatal Mental Health Project, which is really about staff development and staff support, adolescent and youth health service centers, and capacity development for all these things that we say are nice to do, but are not often seen in practice. So we're going to have to work out how this actually looks in those 3 sites. The third one is the health ecosystem, and this will look much more familiar than the previous ones. We want to put some petrol into the intercalated MBCHB program. At the moment, there's an extra year that MBCHB students can take after their 3rd year in molecular medicine. We want to develop a global health option for that 4th year. And we've gone some way towards developing that, but it stalled a couple of years ago, and so we want to resuscitate it. Those of you who remember Tolu Oni from Public Health was halfway through developing that program. And then the postgrad diplomas, largely in public health, economics and health financing, health leadership, health professions education. We want to promote those, as well as the MPH, the ones that actually make a difference on the ground, MSc in Epi and biostatistics. And then there's a particular fellowship for women in global health with University of Toronto and Moy. So some of these things are going to come in from other universities' initiatives. We are likewise going to cross-fertilize to them. We want to have a go at developing new programs in health promotion and social accountability. If Isak is on this call, he'll be happy about that. And health professions education. And there are new tracks in the MPH that our colleagues in public health are keen to develop in health data science, digital health, disease modeling, health technology assessment, and priority setting. This is all with a view towards universal health coverage. So this is all within the arena of public health, largely, including a new doctorate in public health. But MasterCard also coordinates a scholars program. So, sorry, just to back up a bit, MasterCard Foundation has been involved with UCT for decades. Just historically, it has funded huge numbers of students to attend UCT with quite a wraparound support bursary, covering not just tuition fees, but accommodation and a whole lot of extras. So if you are what's called a MasterCard scholar, you've really got it's the most incredibly generous scholarship. And so they want, part of that program is a leadership development program that they ask all their scholars to undertake, and we want to link with that and see which of our students could participate in that leadership development. Finally, in the ecosystem, the development of programs and short courses, we have a salary for a full-time lecturer in our department to scope the market aligned to the objectives in the project, what we're capable of, and developing short courses for various levels of staff. So it's really about a sort of curriculum development person will need to undertake that. There's also the building and enhancing capacity to train specialists and professionals, faculty development, buyout time for capacity development, and elevating the academic status of primary healthcare and emergency care with joint staff beyond doctors. We want to demonstrate to the Department of Health what the added value could be of joint staff. As you may know, the joint staff space has become quite restricted. If we can show that it really is worthwhile for the province to invest in a joint position, that would be really worthwhile. We want to build an efficient and supportive cross-sector health network aimed at strengthening the health system through research, mentorship, and leadership and governance. So this is where the FACE Research Center will come in. It's a vision of classes to develop the research center for FACE that is focused on primary care, and we want to give it some petrol to start off with. This is the final objective, networking. I'm just looking at the time. Interventions to develop a dynamic long-term network of partners through respectful community engagement and accountability. We're going to have to set up community advisory groups in each of the 3 sites. We've set aside a little budget for them to come together and to meet and to advise as to what will work and what will not work in their particular communities. Ultimately, we want some form of co-creation of the not just the services, but the teaching that happens within those sites and the research that emanates from it. And we need some accountability to those communities. We can't just make assumptions and go in and intervene on things that make sense to us. It really needs to be in partnership with community leaders. I've mentioned the Family and Community Research Unit. Maybe if Klaus is on the call, he could expand on that in a minute. And then the idea of translating into policy and practice all the good ideas that arise from this opportunity. And of course, as I've mentioned, there'll be lots of international collaborations. There already are some on the table from University of Toronto, which is ahead of the game in this. They've been partnering with MasterCard for many years, and we're the new kids on the block in a way. And finally, when we sent in the original proposal, which was sometime last year, MasterCard Foundation came back to us and said, but what's your sustainability plan? When the money runs out, who's going to pick up the tab, or what is your plan to make things stick? And so we've had to apply our minds to that for the second iteration of the proposal, which we sent in a few weeks ago, around the same idea of consultation, co-creation, governance, and accountability being the foundation of sustainability. But generating the evidence is the really important thing. So we've got the opportunity with 8 years of funding to not only innovate and implement new interventions, but to monitor their impact over time. And so we should be able, by the end of the 8 years, we should be able to show what works and what doesn't work with data. And that's a major challenge, but it's one that we can address ourselves to. And then we want to obviously diffuse the learning across districts and province and even nationally, what has been learned through publications and through a communication strategy. So here, the funding sustainability, the operational teams will be funded throughout the program. We're talking about year 2, in other words, 2024 to start in Klipfontein, 25 to start in George, 2026 to start in Saldanha, right to the end of the project. But those academic posts would only be funded for 5 years, and then we need to be able to show that they generate enough revenue to be self-sufficient. And likewise, the service teams and registrars, we will fund for their period of training, the registrars for 4 years, obviously. And then we'd need to negotiate with the province. Do you want to take this on? Does it make sense to have is it worth your conversion of a medical officer post into a registrar post? Have we been able to show that extra pair of hands is really worth it? And likewise, we've asked the Schools Development Unit and Bertha Centre, the GSB people, to show how their interventions would be self-sufficient, would become self-sufficient and generate an ongoing income. I don't know how that'll exactly be done, but they're the guys with the ideas. This is my last slide. We will address ourselves to these objectives for the first 3 years, and then there'll be a formal evaluation that's actually led by AmRef, who have been subcontracted by MasterCard to do the evaluations. We'll then readjust our activities and for years 4 to 6, when there'll be a second major evaluation, and then there'll be a final evaluation, probably for us at year 8, end of year 8. The likelihood is that we won't spend all the money by then, so we'll probably go into a no-cost extension for year 9 or thereabouts. But we'll cross that bridge when we come to it. It's all very overwhelming when you start putting the budget together and just spread it out on a spreadsheet over 10 years. It just looks impossible. The numbers involved, we initially put a budget together because they didn't give us any guidance, that came to almost 50 million US over 10 years. They came back to us and said, please scale that down. We can only give you 35 million US. And so we reduced it to the funding period to 8 years. And that's the budget that we submitted a few weeks ago. When you do the maths and translate 35 million US divided by 8 years and divided by the multiplied by the exchange rate, you get to something like 60 million rand per year. That's quite a lot of money. It's quite difficult to spend that amount of money in a year. But we said we would do it, and we'll give it a go. But it does mean a lot of posts. It means people in 3 sites plus a sort of central coordinating group, basically project management group that is probably based in Cape Town. And sure, it all seems a little bit overwhelming. But Tracy's been on a complete high. I don't think she had a Christmas because she was developing this proposal. But yeah, I'd be very happy to take questions because we're going to need all the help we can get. So any questions? I'm just seeing the chat for the first time. Yeah.
Thank you, Steve.
Yeah, if you could help me field the questions, Drew.
Yes. Firstly, to say it's a quite daunting project in terms of the size and complexity and scope of it. So, and firstly, thank you for putting all of this together, because just assimilating all of the information and putting it into some coherent proposal is a significant job. So thank you on behalf of all of us. Can I open the floor to any questions? If you can raise your hand, or you can post them in the chat group and I'll read them after Steve.
I'm seeing Ntsiki's comment about mid-level community psychologists. I think that's a great idea. Those are exactly the sort of suggestions that we need in Ntsiki. They would need to come through the community groups. You know, do you think that the community groups would see it as a major problem?
If I may, Steve,
yeah.
Thanks again. I mean, for sharing this. I think it would be critical if one considers the attitudes to mental health. So it's important that the people are drawn from the communities, because I mean, negotiating access and understanding the nuances that are inherent in communities is going to be a critical point of departure if one is going to make a difference. And we know that COVID had a lot of impact on communities. I mean, people did not have closure. So there's a lot. And I mean, we've seen the eruption in schools, the violence in schools. It speaks to, I mean, the need that is out there. And we know that schools and university have a particular role in perpetuating, you know, what manifests as, you know, these eruptions. And it's because Families and communities have for the longest time provided, a protective environment. And more, as communities and families are disrupted and there's migration either way, we then see these disruptions. Universities, certainly, the isolation in itself creates that space for students to address issues that they have not addressed before.
Brilliant, Nsiki, thank you for that. I see a discussion between you and Sarah. Thanks, Dan.
Apologies.
I don't know if I tell again. Sorry, guys.
Apologies.
I'm not going to be able to.
Yeah, we will cut off. How much?
Somebody, Crystalline, can you mute? Teresa.
Sorry, Steve. I was trying to unmute, but the
Okay.
the chat's pop-ups kept covering the unmute button, so I had to close them. Teresa has got a question. Teresa, go ahead.
Steve, just quickly, I thought you were picking up something that Dan had said. Sorry, I joined a bit late, but what are the 3 sites?
Klipfontein, George, and Saldanha.
Okay, so then I did find it a little bit professional heavy, and from the comments that Nsiki's made now and Sarah, I would have liked to see more emphasis on community-based workers, because we pay a little bit of lip service to them and the mid-level workers. And if you want to be innovative and entrepreneurial and sustainable, we really need a broad base of community-based workers, and much more thinking and development about what is their transition. And I mean, even can they transition into these kind of other levels of programs and up to PG dips, because it's going to challenge our programs at UCT to change entrance criteria then, if we really want to feed into what Nsiki is saying about strengthening capacity for health and health promotion at a community-based level. So I find it still a little bit top-heavy of professionals and what people can do from PG dip up, and not. So I question that a little bit, and
Let me respond to that, Truth, because we were also a little bit skeptical of that. The MasterCard history with UCT has just been to plug money into student bursaries, right? That's all they did for years and years, for decades, literally. So this idea of working with communities and non-university students, not at a tertiary level, is like, for them, it's like, whoa, this is very different. So yes, it does seem top heavy. We've put a lot of emphasis on mid-level health workers in both objectives 1 and 2, the employment and the entrepreneurial space, hoping that we can address that sort of gap. It's outside of the MasterCard Foundation's comfort zone, which is fine, and we need to find ways that work. We need to learn from your CRW experiences. If we put petrol into something, how is it going to be sustainable? How is it going to be continued? Then if we put some 4 years of funding into community-based counselors or psychologists, how would that be sustained and sustainable?
And Steve, how does it change the entrance criteria so there's flexibility in terms of using recognition of prior learning and work experience, that people can come into these other programs, OT, physio, speech, public health, biokineticist, all that kind of thing? Because I think that we underestimate the role that sport, physical activity, the work that I don't know what they're called, the community health programs that Sports Science has been running, they really break barriers around the social exclusion people have been experiencing. They address the chronic diseases of lifestyle in a way that also helps prevent impairments and disability. But they don't get enough funding and enough support, and the people working on them also don't get enough opportunity for progression.
Yeah.
So if that's noted, then I'm happy to see that something will be done on that.
Yeah, what you're talking about, and I'm sharing the screen, I hope you can see it, that you're really talking about these first two major objectives.
Okay.
This third one is the tertiary level thing, but these first two are really aimed to be community based as far as possible.
Yeah. Because the COPC have had very little about disability and rehab in the initial thing.
Yeah.
And I was a little bit surprised to hear that we've been introduced as differentiated services, which is as bad as being allied health professionals.
Right. Steve, there was a question from Sarah in the chat about the timelines of this project. When do you see it coming on the screen?
The first iteration of the proposal went in November last year. The second iteration towards the end of January, a few weeks ago. We're hoping to hear in the next, I don't know, month or two. They have to take it through their board. They were fairly upbeat about our second iteration of the proposal and the budget, which was just under their ceiling. So we could start as early as April with actually employing people and getting the show on the road. We aim to have a launch of the whole project. That's all 8 partners, etc. We've offered to host the launch at UCT with Sue Harrison in sometime in October this year, assuming that we will have got the money by then. And so it'll be all systems go from 2024, but starting incrementally in Klipfontein, and then the following year, George, the following year, Saldanha.
Thanks, Steve. The next question is from Tasneem.
Thanks, Jeroen, and thanks, Steve. So I want to just make 2 comments, and they're more introspective based on on Teresa's input. The first is, as we start engaging with communities and doing joint agenda setting with communities, the kind of resources need to flow pretty agilely in accordance with those agendas, because we may have an agenda coming from a top-heavy kind of a professional perspective, and communities' agendas may be different. And so our planning would need to be pretty agile around that. And the second issue that I picked up from Teresa's comment, which I wanted to highlight, was the fact that there may be several structural barriers within the systems in which we work, whether it's in the health system, educational system, which we also need to become advocates to challenge if we're wanting to break down certain of these kind of structural issues that impede communities from accessing both systems. So it kind of, we've got to be thinking in pretty agile ways as we navigate this, at least that first year.
Yeah.
Thanks, Steve, for all the work that you've done so far. Wonderful.
Yeah. Thanks, Tasneem. That's useful.
Jackie has a question.
Hi, it's more of a comment. I'm just picking up on the community-based engagement and interventions. AfrHE-HCo is actually extending and our model of working, because normally when our services run in the Cape metropolitan area, as everybody knows, it's UCT students who run the programs. But when we move to the phase 2, where we have George and we have Saldana, we've moved to a slightly different model of then hiring early career social workers. So the social work students who then worked at Shawco running the program in the Klipfontein corridor, for example, would then, you know, we would have a whole selection process, but then we'd have 2 early career social workers moving up into these areas and actually running with a train the trainer model. So it's more of building local capacity, and the program that we will be running it's called I Matter, which is a whole lot of mental health stuff that builds then up to violence prevention programs. So that's really what we're hoping as we go, that we will work closely with NPOs in the area, and for that sort of needs group of young people who are unemployed and not in any sort of training. And all of that will be, they will be overseen by our social worker who's very experienced, and she can ensure referral pathways. And that really builds sustainability as well, as how you create and work with local partners in the area. So I just wanted to add that in.
Thanks. Taking notes. Lots of notes.
And then the last question is from Christaline.
Hi, good afternoon, everybody. Thank you so much, Steve, for your presentation.
That sounds like Bahia, not Christaline.
Yes, it is. No, we're sitting together. We're sitting together, and we were cut off from the laptop. So Suki is here as well.
Oh, great.
The question is from me, just for a little bit of clarity. The first one is, in terms of the scholarships that are on offer. So how people actually apply for these scholarships, has that been worked out already, or must it still be developed? That's my first question. And my second question is, where there was one section where it refers to that some people will be allowed buyout in order that they maybe, I don't know, my interpretation of that is further their research or further their studies or whatever the case may be. So with that question, I want to know, does that only apply for academics? Because we were told about an offer for buyout in a previous course that we were in, and it didn't happen. So I just want to know. I just want some clarity on that, please. Thank you so much.
The buyout thing was really specifically for people in the service who could not attend a course because they had a full-time service obligation. So it was intended for people who wanted to undertake, say, a postgraduate diploma or whatever, who had to take time away from their service duties. And then the other question, yes, we will have to work out the criteria for selection for the bursaries and scholarships. You know, the criteria would probably be weighted in favor of applicants who are from one of those 3 areas, who are women, who are young, who are from disadvantaged communities, those kind of criteria. And we would have to have a selection process which hasn't been worked out yet.
Thank you so much.
Okay, I think that brings us to the end, Steve.
Yeah, I feel like we're going to need everybody's help with this. We obviously are going to recruit new staff to start this thing off. I'm going to look for people with project management skills over the next few months. Once the ship comes in, it will be all action stations to recruit new staff and get the show on the road. So I would expect a small team to be based probably in Cape Town, maybe at Klipfontein, to start the ball rolling. Hopefully within the next couple of months, but watch this space and we'll let you know.
Thank you, Steve. And thanks everybody for attending. Our next seminar is going to be on the 7th of March, where Wasila Khan is going to be talking about transforming postgraduate emergency medicine training at a national level. So please all do attend. That's the 7th of March, which is also Tuesday at 1 p.m. as per this time slot. So thanks for all of you for attending, and thank you, Steve, for the info on what looks to be a great initiative.
Thanks, guys. Right on time. Have a good afternoon. Cheers.
Thanks, Steve.